to be able to connect with each other, have a drink at a bar. It's going to be challenging because a lot of folks are not going to be comfortable doing that just yet. But we'll get there. And we've seen the last couple of days, when I look at the market, I've seen some really good things, and the market is really, future predictions and future analysis. It's not what's happening right now, it's what, the future is looking like. And, from what I've seen, the future looks like we're gonna bounce back from this, and we're gonna bounce back very well and very strong.
Kevin, thank you very much. And I think based on what you said and what other people have said, I do believe actually the market will bounce back, and there will be probably a regional renaissance in places like California and New York, maybe less on a federal level. What will be the challenge, and that's something I think as a Women's Foundation, and I know Thrivent and other people, the question is how to save the baby boomers, the okay boomers, or the minorities that the market may consider to be dispensable, basically not, major consumption sources. So I think at the same time that it's great to be empowered to talk about the market, and I feel, I appreciate your updates each week because it does kind of give a good analysis of where we are each week, and it's changing so much. So that's really the value of it, in addition to feeling more comfortable with one's securities and, what one should do. Carl, are you here with us?
Yes, I am. Can you see me or hear me? Can you see me or hear me?
I see you, Carl. Maybe you can say a few words. He's zooming in from London. Carl is another classmate of ours from CUSWF Friends, as well as a lifetime reporter. Yeah, good. So, yeah, I can see you and hear you now. Welcome. Welcome, Carl.
Thank you.
So he was going to say a few words, kind of impressions from abroad. Carl, if you can hear us and you want to speak a few words, that'd be great.
Well, first of all, can you hear me?
Go ahead, Carl.
You can hear me. Yes. Can you hear me? Yes? No? Yes?
Yes.
Kevin, I'm sorry I missed the beginning of your comments, but very illustrative about how to protect yourself. And it's great that you are, pointing towards a ray of hope and optimism, because it's dire here. I mean, the forecast here is that the economy could contract by as much as 35% in the coming year. I mean, it's frightening. Announcement is expected in the next few, maybe by tomorrow, about an extended lockdown for another 3 weeks. But this is happening everywhere. And I'm, Leslie knows me from school. I haven't talked to her in a while, but I did, a reunion with Sidwell last spring and reconnect. I've been overseas for the past, 20 years or so, working for network news and also agencies like the UN, working in the Middle East and Africa. And, I'm very sobered by what I see, because at the end of the day, America's the best place to come from, the best place to be. And if America's not working, you really have to worry. You're just scared. You're frightened. So I'm not sure what the context is I should be talking about in terms of 2 or 3, points to raise. But since Leslie mentioned this is about women empowerment and finance and whatever, I can just mention 2 or 3 things that just, I came across, which I found striking in terms of, what kind of leadership matters in countries around the world, and how diverse that leadership should be. Also about the impact that we're seeing in the UK now in terms of minorities and women. And then a third topic being, it's really not a front burner topic, but nonetheless of essential importance. The issue about what happens when you have a lockdown and you haven't raising instances, unfortunately, of domestic abuse. So, for example, one question to raise is that is quite frankly, it is. I'm not coming with answers. I'm raising questions. But if I'm raising a question, I'm saying, how important is it to have a diverse range of views when it comes to decision makers, especially at a time of a crisis? And there is an editorial written by a British government official, Andrea Leadsom, who was part of Boris Johnson's government, saying that you need different kinds of people, you need women. Not everything is gender driven, but she was making the point that maybe we would not have been so bullish and gung-ho and just slow to respond. We might have been more careful about, where are our supplies of PPE, what is our ventilator situation, how are we lining up our supply chain, that kind of thing. And then another existential but practical question is, what does this mean in terms of Brexit? Well, after she wrote this article, not because of it, but nonetheless, when he changed his cabinet, she was let go. But, what occurred to me in terms of success stories, because at the end of the day, we live for success stories. What Kevin's talking about, he's talking about success stories. He's talking about individual success stories. He's talking about how you can bounce back. So the story of how people bounce back resonates with how people make the right decisions for a country and society in terms of bouncing back. And so, for example, in this particular column that was written in The Guardian, he mentioned some success stories ranging from New Zealand, Norway, Denmark, Iceland, and Germany, all of whom are countries which are run by women, all of them. And I've now gotten to the habit of watching Spanish TV news every morning. One of my goals in this lockdown period is to learn yet another language, because I speak a few languages. So I'm learning Spanish as we speak. And I'm just struck by how the majority of the cabinet, in fact, it's 11 out of 17 or 11 out of 20, are women cabinet ministers, and they're the ones running the briefings. It's amazing. I'm not saying that decisions are gender driven. I'm saying that it's important to have a variety of views and such. But when I mentioned those 5 countries and such that are doing interesting, important things, Denmark, for example, they'll be opening schools next week, phasing it in, beginning with toddlers and grades up to 11, and children age 11 to 12 years old, on the data-driven basis that those young toddlers and young children are less likely to be carriers of this awful virus. And then you've got the success story of New Zealand, which is at near zero in terms of mortality rate under Jacinda Ardern, who's the prime minister. She's doing a great job. Then, of course, you've got Germany. People are saying, why is Germany, of all the countries in Europe, so successful with what they've done? Well, it's not rocket science, because a decision was made to do early diagnostic testing, which the US didn't do. A decision was made to do contact tracing and those kinds of things. A decision was made to do social distancing. So as a result, they have far fewer fatalities compared to any European country. But it's not because of the person in charge was a woman, but because it allowed for capacity and space for different variety of views. But so the question there is, how important is it to have those different variety of views? And then talking about how it's impacted minorities and women in the UK, what's really startling and striking is that, now the UK is about, unfortunately, 15,000 fatalities. Well, of the first almost 4,000, or actually more correctly, 3,883, apparently, as I'm understanding it, over a third of those, in other words, about, I don't know, a third of 3,800 is like 1,300, 1,400. More than a third of them were from minorities, meaning Blacks, Asians, and minority ethnics, even though they comprise only 18% of the population. This same kind of unfortunate figure is also playing out in other countries, including the US, for example. Why is there such a disproportionate number? And there are lots of reasons why, but that then begs the question is, how do we target messaging and policies and you know, safety nets for those people, because a lot of those people are on the front lines. You know, they're the people working in the emergency rooms. They're the people who are the first responders. They're the people who are working in grocery stores. They're the people who are delivering things to households. So you're having that. So you have this. So as a result, a labor official asked the other day that there'd be an inquiry about not only why is this happening, but what can we do to mitigate this? And just another example is that when it comes to the NHS, which is, you know, the universal healthcare system, and in the UK, you know, 44% of the medical staff of the NHS system. Can you still hear me, Leslie, or? Yes, okay. So 44% of the NHS medical staff, they're minority workers ranging from doctors, nurses, administrators, you name it, 44%. And there unfortunately have been fatalities, there have been deaths, there have been casualties. I think nearly, I don't have the numbers in front of me, about almost 17 to 20 doctors have died, unfortunately. But what's again really, really striking is that of those doctors who have died, the first 10 doctors who died were all minorities. And again, it raises the question, no one has the answer to that. And, you know, there are lots of, you know, ideas that are out there. Some are saying that, well, you know, again, these are people who are on the front line because 44% of the NHS is minority. So they're the ones in the emergency room. So that increases the risk of exposure. You also have the problem that a lot of minorities live in multi-generational households where, you know, maybe those much older people can pass on this infection, for example. And then you've got the fact that, you know, a lot of the people who are minorities, you know, they don't want to complain. They don't want to say there's a problem. Or else maybe some minorities, if they're from other countries originally, you know, they need a translator. They don't have access to translation. And there's no messaging or policies really that specifically, you know, targeting the translation, you know, targeting different languages, so to speak. So there's some big problems there of disproportionate, which are not unique to the UK, It's happening in the US for similar reasons, because other reasons are that, you know, a lot of these people have underlying health issues ranging from, you know, asthma, diabetes, hypertension, you name it. So there's a whole catalog of that. That's the work that needs to be done. And then finally, I just want to talk a little bit about, you know, the domestic abuse. And if I'm sensitive to it, it's because I, you know, in the work that I was doing, I'd done work in Serbia and other countries about, you know, just how much goes on behind closed doors. And it's not always physical, it's also, you know, psychological, whatever. But there is a nonprofit group here in the UK called Counting Dead Women. They're based in the UK, and they noticed that just in this 3-week window, because right now we're just winding up the 4th week of the lockdown here in the UK. So they've taken a 3-week snapshot. And again, it's only a snapshot, but still it's disturbing enough, because they're saying that the numbers of cases, while it may seem like not many, it's still a horrifying number because it's one too many. Cases of women killed at home by their partner because of domestic abuse and violence is more than double. It's like 16 in the past 3 weeks, when it's been an average of maybe 5 a week for the past 10 years. And that's largely being attributed to, you know, the side effects of being in a lockdown situation. And so now it's also being raised by a cabinet secretary that, in fact, it was the Home Office official of the British government, I think Priti Patel, was saying we need to look at what are the effects of the vulnerable being the women or the ones who are dependent on, you know, the breadwinner, the male partner of the household, who are now suffering domestic abuse. And there was a column I was reading today, I didn't have time to look at it more closely, but it was even a tip sheet, a guide for what women should do if they go to the store. Because the only places open in London, in the UK, like I'm sure there, are grocery stores and pharmacies. For me, you know, I'm used to being on the road, I'm used to being in a newsroom, and I'm not used to being at home, to be honest, even though I love being in central London. I'm not crazy about it, but it's fine. Nonetheless, the only places I can go to that are open are the grocery store and the pharmacy. Everything else is shut down and closed, and yet it's beautiful spring-like weather. Nonetheless, here's a tip sheet saying, this is what a woman, if you are experiencing abuse, what you consider if you go into a grocery store. And it's now giving a guide of code words to tell, a clerk or whomever you see in a pharmacy in a store that you need help, that kind of thing. That's how it's gotten. So I'm just saying all of this to explain what this portrait is, and to get back to what Kevin is saying. Kevin is, talking about, making sure you can take care of yourself, you can protect yourself, and sustainable. That's, what the vulnerable people have to deal with as well. I think, I think one of the big takeaways is, and it's harder when you're much older, as people like you and I are, is to accept that we cannot go back to normal. This is going to be entirely different. And so, for example, even though some are saying, well, it'll be extended for another 3 weeks here in the UK, another cabinet minister is saying, well, actually, though, we cannot go back to normal until we get a vaccine. Well, there's no vaccine until at least a year, even if they identify one by September. And then it has to be mass produced. So it's a behavioral thing too as well. And that's what's frightening. And so what Kevin is talking about is really important, it's very key, because, how do you protect and safeguard yourself? Because I'm sorry, not everyone has something that was invested back in 2001 or what. So how do you plan when you're at the bottom? I think that's the question for a lot of people. Nonetheless, you have to be optimistic. I think the best thing right now, one of the things that's happening right now, is the very fact that we're talking to each other. I mean, I don't do Zoom, I never do, but it's a fact of necessity, and it's okay. And I think the important thing is that we build on it when we're just simply sharing information. Yeah. So I'll stop there before I get out of hand. I'm sorry for going on too long.
Right. So, Karl, thank you for that. You always did have good ideas in the classroom. I remember that now. But so, as you said, it is just a dialogue with hopefully some concrete suggestions and ways for us to collectively contribute to getting whole again. Mimi, are you still there? Maybe you could just say a couple words about the Women's Foundation's efforts to, get PPEs to the right people. Understanding is key, but also taking even, micro actions that can make a difference, just to set the ball rolling so that people who say, oh, what could I really do to make a difference, could feel comfortable, like, oh yes, I can take these steps and it will make a difference. Mimi, I see you. Now yes, the floor is yours.
Thank you, Karl. It was really refreshing to hear your opinion, and different view really makes huge difference. And Leslie, yes, here at the Chinese Women's Foundation, ever since the Wuhan outbreak started, we've been following very closely on updates and news, and we've been also communicating with our members in China. So right now, as a platform, we feel, it doesn't matter small or big, we wanted to contribute our effort. So we started this initiative called Everybody Should Have a Mask, especially following over here CDC's guidelines, suggestions, and also New York City. Starting this evening, 8 o'clock, everybody must wear a mask when you're outside of the house. So, but unfortunately, a lot of people do not have the access to those PPE or simple just a mask. So what we've been doing is just to reaching out to people who, like post office workers, if you need a mask, we have a mask we can provide, and also contacting our members, including those members overseas, if they could send us donate masks, then we will take them to the people over here who might need them. So like Leslie said, it doesn't matter effort is small or big, but it is effort, and we want to be helpful. And also we feel a lot of people who wants to help, but they don't know how. So this also provide them with opportunities, you know, for people who are staying at home and a little bit frustrated, and also feel a little bit, you know, wants to find a ways to contribute. So this is also a way for people to get involved. So yeah, that's, I just want to say a few words about our mask initiative. Yeah.
Right. We're very proud of our mask initiative, and it's interesting how viral, I hate to use the word, a PPE mask initiative can be, because I just got or am getting a box of masks, and already I'm thinking, okay, there's a wonderful Lutheran church that has a food bank 2 blocks from me. So instead of like calling and saying, what can I do to help and everything, I will drop that box off to them and say they can use it for their staff, and also they can distribute to people who are picking up groceries. They can also have a few masks, because now that it's the law, some people can't afford masks. So, you know, how great that we could get ahead of it and give it out. So it doesn't have to always be so complicated. Once you have the idea that masks are going to be all important, get masks and distribute them. And then once you get in the habit of it, you can, you know, partner with other groups and make sure, like the city of Newark, which is really hard hit and we're committed to, has access to the mask. So it starts very simple. It starts with just a conversation among ourselves. And, you know, it's a pleasure, I must say, to be with you guys. And, you know, to start a conversation, hopefully will be a force for good, and also a support structure for each other, because we're all going to experience, and the older we are, the more physically we may experience these challenges. So I know that this can be also supportive for our immune systems as well. Does anyone else want to add something? I think, you know, from my perspective, I've covered most everything. We do meet every week, so if you can join again, please do so and invite other people. Anyone have anything else they'd like to add?
Just want to say it's fascinating.
Just want to say it was, but I know your mind is always working. So appreciate that you are with us, and you know, I'm sure if you have good ideas, yeah.
Just want to say it was fascinating hearing from Karl about London.
I'm having a little trouble hearing you.
Oh, let me see if I can.
Yeah.
Can you hear me now?
Yes.
I was just saying it was fascinating hearing from Karl about how things are in London. We've been reading, of course, but it's actually been a big concern of ours, since both Leslie and I had the pleasure of living there in the past.
Yeah, and have my sister lives there. We have, you know, dear friends from university, you know, so, and, you know, supposedly we have, you know, deep roots between England and America. Now, you know, I think an interesting conversation, which we can also have, which just fascinates, I think, a lot of us, is, you know, what is the new normal? I think we have to look out for regionalism. You know, I think New York region, California region, we will bounce back, but is that in spite of the federal, you know, framework? So there will be many changes ahead, and, you know, it's on that level that we can engage while keeping our eye on, you know, things like the stock market and our women, do they have enough cash? So we can get as, you know, kind of intellectual, but also with our feet firmly on the ground.
Hey, Leslie, it's Karl again.
Yeah.
I'm just giving another thought, since your colleague, is it Lisa, was talking about London and the UK. In so many ways, it's like a practical and existential crisis, because, you know, up until a month ago, everyone was talking about Brexit. No one's even talking about Brexit now. And the thing about it is, this particular crisis just exposes the shortcomings and the flaws in Brexit. Because, for example, even though the EU was also caught flat-footed in this whole crisis in terms of being slow to respond, you know, now it's turning out the EU is working out a procurement system to get ventilators, to get PPEs, that they're making available to all EU members. And because of this, offered, you know, the UK the right to access this growing stockpile. But because, you know, the UK is so stuck in its ways, they're saying thank you, but no thanks. So, you know, it's just incredible. And meanwhile, the worst case projection is that the economy could contract by as much as 35% over the coming year. It's just amazing. So, and it's, for me as an American, I've lived here now for more than 20 years, but I mean, most of the time I've always been overseas traveling. I've never been here this long on the ground in London. So it's like, it's an humbling experience, I would say. But I feel as though I'm like a refugee. I mean, I'm caught between this situation here and America where I want to return to, but because of what's happening with this guy, you know, at 1600 Pennsylvania Avenue, I don't know what's going to happen. I can only be optimistic. I think that if anything, the headwinds are hopefully in the favor of, you know, you know, the democratic choice right now. I really hope so. But it's scary here in Britain because, you know, basically people are being told to expect even worse to come, you know, in terms of more unemployment, livelihoods crashing, companies closing, and you know, the idea of like things like pub culture or whatever, who knows, sporting events closed, but that's also Europe-wide. But the point, again, the last point I want to make is that a lot of this is like avoidable. I mean, once you get past the fact that it happened because of wherever it came from, you know, policy decisions were either made or ignored or delayed, and they waited until the last minute. And so now, you know, now the weather's beautiful. It's almost 80 degrees every day, and you can't go out and do anything. But at least compared to Italy, because I have very close friends in Rome and Italy, you can't go out unless you have a piece of paper. And if you have a piece of paper saying that you're going to the pharmacy or store or a doctor's appointment, the policeman will then call that number to make sure that's the reason why you're going there. Else you get a fine of up to 400 euros. You get a fine on the spot, and that'll be added to your record, like a point system if you violate your driver's license. So in Italy, it's very, very draconian. In Spain, it's almost just as bad. And the UK is considered to be 2 weeks behind that. So, you know, even though I can go out for a walk once or twice a day, you know, you're still being told, well, enjoy it while you can, because it could be even more and more difficult.
Yeah,
But
there
then,
definitely will have to be COVID passports. You know, there is going to be you know, for any of us to go back to work in an office, there has got to be some kind of paperwork to assure us that the people who we're sharing space with don't have coronavirus.
that's
so
exactly right. I think Cuomo's saying that. I think that's what Cuomo's
yeah.
saying, is he not?
Yeah, we're all talking about testing, and that is, you know, maybe we can, next week, maybe let's continue this conversation, because it will all be, the conversation will all be about testing and
It's a testing
how
thing.
do we get back to the normal.
Yeah, because it's not zero sum. It's not like saying that nobody goes back to work at all. It's just the ones who are healthy.
That's true.
Well, the ones that have been tested and gone through the clearance. I was talking to a client yesterday, and she was a Russian client, and in Russia, the exact same thing is happening. You have to have documents before you leave your house showing why you're leaving your house, and if you don't, and the documents are not sufficient, you have to stay inside, or you're going to be fined, which is, you know, which is ridiculous. But that's what the rest of the world is facing, versus what we're facing here. So. It's going to be an
Karl,
interesting couple of times.
Karl, I had a quick question. Do you feel like, since Boris Johnson lived through the coronavirus himself, he's a softer, gentler, more empathetic guy now?
Well, time will tell, because right now, you know, he still is not. He's had no public appearances. He has no decision. He's not made any decision-making type things. It's Dominic Raab who's in charge. I think one indication is this. You know, this transition period supposed to end on December 31st, New Year's Eve, where the UK is completely out of the EU no matter what. Meaning that for now, you can still travel, live, and work in other EU countries. Like I can do that. I'm now a dual citizen because I've lived here for 20 years, and I can go to any country and do whatever I have to do to live and work. But after the 31st, it's like you turn into a pumpkin. The short story is, Brussels said, listen, it's impossible to carry out this protracted negotiation when we're in the middle of a pandemic crisis. If you want, we can extend this negotiating period to, for your Brexit, for your exit. And the UK politely answered the other day, I think yesterday or the last day or two, thank you, but no thanks. I mean, a lot of people are really unhappy about that. They think it's like driving off a cliff. So even though he's not in the driver's seat right now, the tone has been set, but it's very, very worrisome. And some people are saying that, at least well, myself, I'm still the kind of guy, I'm a Remainer, obviously, even though I'm a foreigner, but I live here, I have a British passport. I hope they'll come to their senses because, if you're going into a worldwide global recession and you have an economy that can contract by 35%, and do you expect to get favorable trade terms with other countries? I mean, give me a break. When you're part of the world's second largest trading bloc, i.e. the EU, it doesn't really make any sense. It's penny wise and pound foolish. So the short answer to your question is, maybe he's humbled by it, but there's such a stubbornness. But this goes back to my first question that I was raising about how important is it to have a diversity of voices in the makeup of decision making? Because this just really betrays a lack of sensitivity for the real vulnerable people in the society right now. And it remains to be seen. Maybe he'll come out and maybe they'll realize that they can't do everything by the 31st, but the last thing the UK needs is a hard Brexit. A hard Brexit means that no trade deal is being done at all. I mean, already prices are going up. Already prices are going up. It's crazy. I mean, this is a country that can only feed 60% of itself. It imports the rest mostly from the EU. So it's the worst possible time. So why would you want to aggravate and exacerbate it? But and that's why you need that different range of opinions, what we're talking about. So again, when I'm answering, I'm saying it's too soon to say. He's obviously humbled, he's obviously chastened. And people are saying that, well, if everyone thought that everything that Boris did was very Trumpian, this is the first time we've seen that there's non-Trumpian behavior, if you will, because he is humbled by this near-death type experience. But policy-wise, nothing is changing, and that's what's scary. And I think people are really frightened. And so for myself personally, I'm trying to figure out where the heck do I go? Is there a job to go back to Washington? To move back to Europe or what? And then I should be talking to Kevin about how do I save and protect whatever assets I have, and where do I put them? I mean, I'm scared about them. And also the last thing I'll say is the pound is crashing. When Brexit happened, the pound was at 150 to the dollar, and now it's hovering around 119, 120. I mean, it's just crashing. So, it's the most important thing is that you have your health. If you have your health, you're great. And as you rightly said, Leslie, last thing I'll say, we can phase into starting up the economy by making sure that the people who go to work are healthy. That's it. Do that testing until the vaccine comes along.
Then you have to worry about, say, ageism, because the next thing will be, well, anyone over, say, 65, for example, they are more vulnerable. Therefore, you know what? The company doesn't really want to bring them back because the higher risk factor. So it's same thing with women. Oh, do we really want to bring back? She has to be home for the kids because they're, the schools are restricted. So it's going to be a great opportunity for ageism, sexism, so hold on to your hats. What you're describing in terms of Brexit, which I hadn't even really thought about, will experience as that new normal, the, Corona passport that you'll need. I'm sure it will play out with many, terrible, unless Elizabeth Warren is vice president.
You're showing your cards.
I'm just kidding, but
we should take a poll on who we think the number 2 will be. I mean, is it really important, do you think, who he chooses as number 2?
Yeah, really important. Very important. I mean, we can't mess up anything. But yeah, why don't we continue that conversation? I think we're finished with our official hour. I feel like it's like telling the Passover story each year. If you do have an hour's worth of Zoom each Thursday, good things will come. So we've done that, and I look forward to seeing all of you again next Thursday. We'll send an invitation and an update, and be well, be healthy. Take care.
Thanks.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks.
Stay
Thanks, Leslie.
safe.
All of
Healthy.
you. All of you. Thanks.
Thanks.
Bye.
Bye-bye.
Bye.
Bye. Bye-bye, Leslie. Bye, Kevin. Thank you.